Welcome to our webinar, Talking to Your GP About Pain. This webinar was produced by Arthritis South Australia and was funded by the Country SA PHN. Did you know that 1 in 5 Australians live with ongoing pain? Because so many Australians live with pain, many GP appointments are made to discuss pain and how it can best be managed. However, pain can be a tricky thing to explain and can be a hard topic to discuss with your GP. This webinar is designed to help you better understand pain and to give you some tips to help discuss pain with your GP so you can get the most out of your appointments. This webinar is largely based on the 2019 National Strategic Action Plan for Pain Management. This important document provides a framework for supporting all Australians who live with pain. During this webinar, we will explore 4 main sections: understanding pain, preparing for your GP visit, tips for talking to your GP about pain, and at your visit. Let's start with understanding pain. In this first section, we'll discuss what pain is, how it is classified, and the places where you can learn more about pain. Pain is a complex topic, and as we have already mentioned, can be tricky to discuss with your doctor. Learning about pain and understanding pain can help you to have more productive conversations with your GP and ultimately give them the information they need to provide you with the best possible care and support. Remember, GP appointments can be short, and usually there are many things you might want to discuss. Therefore, if you can clearly and concisely explain your pain to your GP, the better they will be able to help you. Before we move on to discussing the different types of pain, it is important to understand that pain affects everyone differently, and that there are many factors which cause people to be in pain. These factors are known as contributors. The National Strategic Action Plan for Pain Management breaks these contributors down into 3 overlapping categories within an evidence-based biopsychosocial model. Under this model, it is now understood that pain is caused by a mix of physical, psychological, and environmental contributors. Or to put things more simply, many different things cause people to feel pain. It is not just a physical experience. There are 3 main types of pain. Firstly, nociceptive pain. This type of pain occurs when a body tissue, for example a muscle, organ, or connective tissue, is damaged, resulting in pain. This type of pain is usually described as sharp, aching, or throbbing pain, and can be caused by a range of conditions or contributors, including physical injury, surgery, arthritis, and other musculoskeletal conditions. The second type of pain is neuropathic pain. Neuropathic pain occurs following damage to the nervous system itself. The nervous system being the part of the body which transports messages to and from different areas. The sensations associated with this type of pain are normally described as burning or shooting pains. This type of pain can also result in the skin being numb or tingly or very sensitive. The final type of pain is nociplastic pain. This type of pain is related to increased nervous system sensation rather than actual tissue or nerve injury. Although someone experiencing nociceptive pain will have pain and discomfort, there is usually no clear evidence of actual or threatened tissue damage, meaning someone may be in pain, however, there is no obvious cause. Depending on several factors, people experiencing either nociceptive pain, neuropathic pain, or nociplastic pain are categorized into one of 5 pain categories: acute pain, subacute pain, chronic pain, recurrent pain, or cancer-related pain. For example, someone may have chronic neuropathic pain, while someone else may be experiencing acute neuropathic pain. The National Strategic Action Plan for Pain Management provides an explanation for each pain category. Firstly, acute pain. Acute pain is defined as a normal and time-limited response to trauma or any other noxious experience, including pain related to medical procedures and acute medical conditions. Acute pain can also arise from physiological causes, such as childbirth or injury. If poorly managed, acute pain can lead to more serious health issues or transition to chronic pain. The second category is subacute pain. Subacute pain is pain that is progressing towards chronic pain, but this pain may be prevented. For example, acute wound pain may progress to chronic wound pain if it is not properly managed. Thirdly, chronic pain. Chronic pain is sometimes referred to as persistent pain. This category consists of any non-cancer related pain which lasts for longer than 3 months. Chronic pain is a major symptom of arthritis and is the focus of this webinar. The final 2 categories of pain are recurrent pain, for example pain associated with migraines, and cancer-related pain. There is an overwhelming amount of information on pain available. For the most accurate and up-to-date information on pain, here are some handy tips. Firstly, talk to your healthcare team, such as your GP, a specialist, or allied health professionals involved in your care. They'll be able to help you further understand pain and the best ways it can be treated. Another thing you can do is get in touch with Arthritis South Australia on 1800 011 041. You can speak to our friendly staff via our free arthritis info line or explore our pain resources at www.arthritissa.org.au, where you can learn more about pain and the different ways it can be managed. The second section of this webinar explores how you can prepare to discuss pain with your GP. Remember, GP appointments can be short, and often people have more than one thing they want to discuss with their GP. As a result, it can be difficult to remember everything you want to cover. The following tips will help you to prepare for your next GP visit so you can get the most out of your appointment and get started on the way to managing your pain. Tip number 1 is to be focused. As simple as it sounds, when you're making your appointment to talk to your doctor about pain, do not plan to discuss any other issues. Dedicating the time and focusing on your pain specifically is an important first step in developing a plan for managing your pain. Secondly, if you think you need extra time to discuss your pain with your doctor, book a longer appointment. If you do want extra time, always ask the receptionist when booking your appointment that you would like to book for a longer session. This extra time will help to make sure you are fully able to explain your pain to your GP, while also giving them the time to explain how it can be managed. The third step is to be prepared. Preparing for your GP appointment is very important. Sometimes there can be long times between appointments, or you may have trouble remembering once you're in the room what you wanted to discuss with your GP. Writing down a few short bullet points or questions you would like to ask is a great way to stay on track and can help make sure you keep things focused on your pain. The final tip is to take a family member or a friend with you to your appointments. This can make sure that you remember to ask the doctor everything you wanted to discuss, as your friend or family member can remind you of questions you may have forgotten. Taking someone with you to your appointments can also help you if you're feeling anxious about your appointment or if you have trouble expressing yourself or explaining your pain. The third section of this webinar provides you with some tips on how to talk to your GP about pain. As we have already mentioned, pain is complex. There are many different types, and depending on how our pain is impacting us, it is categorized in different ways. To make things even trickier, pain is also invisible to others. So it is important to try to explain your pain to your doctor in a clear and simple way. and the next slides go through some tips and tricks to help you do that. In this section, we will cover the following points. Firstly, how to describe your pain. Secondly, how to describe how your pain feels. Thirdly, explaining and talking about the things you have done to try to manage your pain. And finally, how to explain the impact that your pain is having on your life. Here are some tips to help you describe your pain to your doctor. Firstly, let them know how long the pain has been a problem for. Has it been days, weeks, or months? Or has it been a problem since you performed a certain movement or activity? Next, describe whether it is a new pain or if it is a pain that you have experienced before. Next, let them know if it is affecting more than one area in your body. And if it is, which areas is it happening in, and where is the pain the worst? Finally, it's important to let the doctor know if certain activities make your pain better or worse, or if the pain is better or worse at certain times of day, such as the morning or the evening. The next thing your doctor will need to know is how your pain feels. Quite often, they'll get you to rate how severe your pain is using a 0 to 10 scale, where they'll ask you to rate your pain from 0, which means no pain, to 10, meaning the worst possible pain. Next, it's important to describe your pain using key words of how your pain feels. As we mentioned at the start of this presentation, in the Understanding Pain section, the different types of pain all feel slightly different. Therefore, we need to use words to help the doctor decide what type of pain you might be experiencing. Use words like sharp, dull, throbbing, stabbing, burning or aching to describe your pain, or any other word which you think best explains your pain. Finally, it's important to let the doctor know if you experience any numbness, tingling, or weaknesses around the body. It's also important to have a conversation with your doctor about the different things you have tried to do to manage your pain, and let them know whether or not they have worked. If things have been successful, also talk to the doctor about how long they actually worked for. Some things you may have tried are things like medications, hot and cold therapies, allied health management such as physiotherapy, occupational therapy, or psychology, self-management such as exercise and healthy eating, or other management techniques such as relaxation and mindfulness. Finally, it's important to talk to your doctor about the impact pain is having on your life. As we have mentioned throughout today's presentation, pain is not just a physical experience. It affects all aspects of our life. Therefore, we need to be able to explain to our doctor just how big an impact pain may be having in our lives. For example, does it interfere with you doing the activities of daily living you need to undertake, such as work, travel, home duties, and personal care? Or are there any specific tasks which you find very difficult? And is your pain impacting your emotional, mental, and social well-being? The final section of today's webinar talks about the things that might happen at your visit, including being referred on to other health professionals and the different treatment options which may be presented to you to help manage your pain. In this final section, we'll attempt to answer the following questions. Are there any other health professionals who can help manage pain? Will you need to see a specialist? What options are available for treatment? And will I need medications? This list is not exhaustive, and you may have other questions you want to ask your GP. Again, remember, you can always write down any questions you would like to discuss with your GP before your appointment to make sure you get everything covered off and that you don't forget to bring anything up during your appointment. There are a number of different healthcare professionals who can help support you in your pain management. The next section will look at 4 key allied health professionals who are usually involved in pain management. The first type of allied health professional we'll talk about are physiotherapists, or sometimes just known as physios. Physios can advise you on exercises, posture, mobility, and other exercise-based therapies to help you manage your pain. Exercise plays a big role in pain management. However, when you live in chronic pain, it can be easy to become fearful of movement and activity. That's where a physiotherapist comes in. Physios can advise you on safe treatments and activities to help you manage your pain while keeping your joints and muscles flexible and mobile. The next allied health professional we'll talk about are exercise physiologists. Exercise physiologists are healthcare professionals that provide tailored exercise programs to help you manage your pain. Next, psychologists. Psychologists are healthcare professionals trained in helping people cope with negative thoughts, feelings, and behaviours. As we have already discussed, pain can affect people psychologically just as much as it can affect them physically. Psychologists can teach you ways to cope with pain and its emotional impact. Finally, occupational therapists. Occupational therapists focus on promoting health and well-being by enabling people to participate in the everyday occupations of life. OTs use ergonomics, aids and appliances, and joint protection principles to help you get back to doing the things you love to do and the things you need to do, even if it means doing things a little differently. Sometimes you may need to see a specialist to make sure your pain is effectively managed. Depending on your circumstances, there are many different types of specialists who can help you with your pain management. Your GP will refer you to an appropriate specialist when and if you are required to see one. There are a number of different specialists who typically see people struggling with pain. Firstly, rheumatologists. A rheumatologist is a doctor who specialises in the diagnosis and medical treatment of joint, muscle, and bone disorders. Next, orthopaedic surgeons. An orthopaedic surgeon specialises in the diagnosis and surgical treatment of bone, muscle, and joint disorders. And finally, pain management physicians. Pain management physicians often work alongside a team of multidisciplinary health professionals to medically manage and coordinate the care of patients suffering from pain. There are many different treatment options available to help manage pain. As pain impacts everyone differently, it is best to work with your GP to explore which options are going to be best and safest for you. Here are some things to consider when working with your GP and deciding on a treatment. Regardless of the type of treatment, or whether it is medication-based or not medication-based, there are some key things to consider before deciding on a treatment. Firstly, is it evidence-based? Evidence-based simply means that a treatment is supported by research. Evidence-based treatments undergo rigorous testing to help ensure that they are safe and effective. Next, as the treatments for pain all work in different ways, it is important to talk to your doctor about how each treatment works, the benefits that they are designed to have, and how likely they are to work. Finally, it is important to consider the side effects or risks associated with any treatment you have been prescribed or recommended. Your doctor or treating health professional is always the best person to have these conversations with, as they best understand your health and personal needs. Other things you may wish to consider include the frequency of treatment, such as the number of times per day, week, or month you might need to use the treatment, how easily available the treatment is. For example, is the facility you need close by and are you likely to attend? And finally, the cost of the treatment, remembering that sometimes subsidies are available for certain treatments or conditions. As the different types of pain, including nociceptive pain, neuropathic pain, and norsoplastic pain, all impact the body in different ways, the medications used to treat them may differ. Additionally, everyone responds differently to medications for pain, meaning there is not always a one-size-fits-all approach. Your GP or specialist are always the best people to discuss medications with. It is also important to inform your GP and specialist of all the medications you are taking, including anything you have purchased over the counter or any complementary medicine you may be taking. This is because they may interact or cause unwanted side effects with other medications you may be on. Here are some things to consider when deciding on a medication. However, it is important that we stress again that any decisions around medications must be made by talking to your doctor or treating specialist. Also, if you can't remember everything that has been discussed about medications with your doctor or specialist, asking for an information sheet or fact sheet on a medication can be helpful, as you can read it in your own time. Pain management is a constantly evolving and developing area. There is often talk in the media about medicines, complementary therapies, and other ways of managing pain. And sometimes it can be hard to tell if this information is evidence-based or not. We thought it important to provide you with the details of NPS MedicineWise, a website which provides evidence-based information on medications, including those used to treat pain. For example, in recent years, opioids and medicinal cannabis have been popular topics in the pain management area. NPS MedicineWise have great resources which cover both of these topics and all other areas of pain management to help you get information that you can then discuss with your doctor when making decisions about your treatment. As we have discussed throughout this webinar, there are many things to consider when talking to your GP about pain. To recap on everything we have covered today, let's finish with making a plan. Firstly, it is important to learn about the different types of pain and the different categories of pain, and also how pain affects our body. From there, take some time to prepare for your GP visit. For example, decide whether or not you need a longer appointment, write down any questions you may have, or organise a family friend or family member to come along to your appointment with you. During your appointment, clearly describe your pain to your GP and work with them to decide on what treatments are going to be best for you. Remember, these treatments may include being referred onto an allied health professional or specialist. Also, your treatments may include a mix of medications and other non-medication based treatments. For example, exercise-based therapies. It is important to follow the instructions given to you by your healthcare team about any treatments you are prescribed and adhere to the doctor or health professional's instructions. It can also take a while for pain treatments to take effect, and you may need to try different things to see what is right for you. Again, it is important that you discuss any treatments or changes to treatments with your GP. Finally, as part of your plan, continue to learn about pain and pain management, remembering that it is a fast and constantly evolving area. It is important to keep learning about pain from trusted sources such as Arthritis South Australia, NPS MedicineWise, and of course through your doctors, specialists and allied healthcare team. If you have any questions about anything that has been covered in today's presentation, please feel free to contact Arthritis South Australia via our free information line on 1800 011 041 or connect with our resources through our website at www.arthritissa.org.au. Thank you for joining us for today's webinar on talking to your GP about pain. This webinar was presented by Arthritis South Australia and funded by a grant from the Country SA PHN.